Assalamu alaikum. We'll talk about dental radiology today. We have different type of radiograph intraoral like periapical, interproximal, uh, or then we have occlusal radiograph as well. For interproximal, we take you can say bitewing radiograph. For periapical, we take periapical radiograph, and sometimes you need occlusal area as well. Indications for periapical radiograph is that detection of the apical infection, periodontal status, dental trauma, and assessment presence of unerupted teeth, or during endodontics and preoperative assessment and cyst evaluation. There are two techniques of for periapical radiograph: parallel technique, in which the film holder is remain parallel to the along the long axis of the tooth. The ट्यूब हेड एम्ड एट अ राइट एंगल. देखिए यहाँ से ट्यूब आ रही है, राइट एंगल है, लेकिन फिल्म और tooth is parallel. That's why it's called parallel technique. This is usually reproducible and foreshortening and elongation इसमें बहुत कम होती है. Bisecting technique in which the film is placed close to the tooth. There's an angle and form between the tooth and the film. Mentally it is bisecting. You can see. Okay, the tube is directed at the right angle to the bisecting line. यहाँ एक bisecting line देखिए बन रही है. अगर मैं इसको क्लोज कर लूँ, देखिए यहाँ bisecting angle line एक बन रही है. इसको इससे 90 डिग्री का होगा the tube head. It's not reproducible. There's a different angulation, you can see. With time you will be able to learn it. Comparison of bisecting and parallel technique. Advantage of parallel techniques: geometry accurate images produce होती हैं. Shadow of zygomatic bones appears above the apices of molars. Periodontal levels are well representation. बहुत अच्छी representation होती है इसमें. Periodontal bone level की periapical tissues accurately shown. Better detection of proximal caries. Horizontal vertical angulation of are variable determined. X-ray beam correctly aimed. So there is no cone cutting and they are reproducible. It's difficult procedure to master and sometimes uncomfortable to the patient. Advantage of bisecting technique: patient for film position of the film is comfortable with the patient, simple and quick, and you don't need to hold for that. But there are so many disadvantages of bisecting technique, so it's not a good you can say thing. The disadvantage you can say of this method is that when you do periapical radiograph, sometimes there's overlapping of the root canal when you are doing a root canal treatment. So you are supposed to shift the tube either 20 degree either medially or distally to avoid the overlapping. You can see here it seems to be two canals, but when you move it either medially or distally, you can see the four canals. Bitewing radiographs usually done for detection of dental caries, the progression of moisture of the dental caries, assessment of the existing restoration, assessment of the periodontal status. It's a very good radiograph, and sometimes ocular radiography is also very important to assess the periapical assessment for who cannot be tolerate periapical films. This is the you can say ocular radiographs. And the indication is that detecting presence of unerupted canines, detection of buccolingual relationship of unerupted canines, evaluation size of the lesions, and assessment of sometimes the fracture of the jaw. So that's all about a brief introduction of dental radiology. Thank you very much. Take care. Allah Hafiz.